Welcome to This Explainer. Today, we're tearing down the walls around something you've probably heard referenced a million times in casual conversation, yet is so rarely understood in its true clinical reality. We are going to break down the complex, often completely hidden world of obsessive compulsive disorder using some highly revealing data.
Let's kick things off with a number that honestly stopped me in my tracks. 17. 17 years is the average time it takes for someone experiencing OCD symptoms to finally receive treatment. Think about that for a second. That is nearly 2 decades of suffering in complete silence. And that massive gap exists largely because of huge societal misunderstandings about what this disorder actually is, the immense shame that patients feel, and a simple lack of recognizing the real symptoms. To figure out exactly why that massive gap exists, here's our roadmap for today's explainer. We'll cover the reality of OCD, obsessions versus compulsions, moving beyond the stereotypes, the root causes, gold standard treatments, and finally, living with hope. All right, section 1, the reality of OCD, myths versus facts. Let's see how our casual language actually masks a very real medical condition. You hear it literally all the time, right? People saying, oh, I'm so OCD about my desk. But let's get this straight right now. If you actually enjoy being organized, if it brings you peace and satisfaction to have a clean room, that is not OCD. You're just a neat freak. True clinical OCD is a whole different ballgame. It is driven by severe, debilitating suffering and immense anxiety that eats up more than an hour of your day and severely wrecks your ability to function at work, at school, or just in your social life. Moving on to section 2. Obsessions versus compulsions, defining the pillars. To truly grasp the mechanics of this disorder, we need to clearly define its 2 foundational building blocks. So what exactly is an obsession? Well, it's definitely not a quirky personality trait. It is an uncontrollable, terrifying thought, image, or urge that violently hijacks a person's mind. Patients actively try to push these thoughts away, but they just can't, and it causes a massive, overwhelming spike in distress. And then we have compulsions. Now, here is something really fascinating. Compulsions aren't just those physical acts we always see in the movies, like washing your hands 50 times. Sure, physical acts like repetitive checking or cleaning are super common, but compulsions can also be entirely invisible mental rituals. We're talking about a person silently counting to a specific number, silently praying for forgiveness over and over, or desperately trying to replace a bad word in their head with a good word, just to neutralize a perceived threat. It's literally an exhausting trap, as you can see in this cycle. An environmental trigger, like simply touching a doorknob, sparks an intrusive obsession, like, I'm going to infect my whole family. That creates intense, paralyzing anxiety. So to cope, the person performs a compulsive behavior, like washing their hands until they bleed. And here is the absolute tragedy of it all. That compulsion only provides a tiny, fleeting moment of temporary relief before the loop just resets and the anxiety comes rushing right back. It is an endless cycle. Section 3. Beyond the stereotypes. Real-world manifestations. Let's step away from the media cliches of just washing hands or lining up pencils perfectly and look at how this actually plays out in real life. Let's look at the data here because the timeline is pretty tragic. A full 25% of cases kick in incredibly early by age 14. Half begin by age 19. That means OCD is deeply derailing kids right during their most crucial emotional, social, and educational developmental years. And while contamination fears get all the airtime, so many people are suffering in complete isolation because of these lesser-known themes. People have horrifying intrusive thoughts about involuntarily harming the people they love the most. Others suffer from terrifying taboo sexual thoughts or intense religious doubts, literally terrified they've committed an unforgivable sin. Because these thoughts violently clash with their actual core values, these patients carry an immense, crushing shame. And that is exactly why they hide it and wait 17 years to ask for help. To put this into perspective, take this electrician. This perfectly highlights how harm obsessions practically paralyze a person's life. He would get this terrifying intrusive thought that he might have hit a pedestrian without realizing it. So to neutralize that sheer terror, his compulsion was to spend hours circling his car back to look for an ambulance and obsessively scrolling the news for hit-and-run reports. His daily routine and his professional life were completely hijacked by this. Or take this heartbreaking case of a teenage girl. Putting her own physical health at serious risk perfectly captures the illogical iron grip OCD can exert over someone.
Her fear of contamination or needing a public restroom was so incredibly intense that she stopped drinking water altogether, which led to severe dehydration and frequent hospital visits. This is the very real severe impairment we are talking about here. Which brings us to Section 4, the root causes, underlying factors. So, why exactly does this condition develop in an estimated 2 out of every 100 adults? What's really happening beneath the surface?
Well, it turns out OCD is multifactorial. It's kind of the perfect storm. There's a heavy genetic predisposition. If it runs in your family, your risk definitely goes up. Then you have psychological factors, like extreme perfectionism. And all of this is often awakened by environmental triggers, like severe psychological trauma or a massively stressful life event.
And the brain scans totally back this up. Biologically, we see clear physical hyperactivity in specific regions of the brain, the frontal cortex and the basal ganglia. On top of that, there's a severe deficit or imbalance in chemical messengers, specifically serotonin, which is what regulates mood and anxiety. OCD is a physical, neurological misfire in the brain's circuitry. It is absolutely not a lack of willpower. Section 5, the gold standard treatments, breaking the cycle. Now for the most vital part of our explainer today. How do we actually break this cycle and get people their lives back? The gold standard is a highly effective two-pronged attack. On one side, we have specialized psychotherapy, specifically cognitive behavioral therapy with exposure and response prevention, or ERP for short. On the flip side, we have pharmacotherapy, utilizing SSRI medications to restore that critical serotonin balance in the brain. Used together, they hit the condition from both a behavioral and a biological standpoint. And this therapy isn't just sitting on a couch talking aimlessly for years. It's a short-term, highly structured timeline. It starts with education so the patient understands their own brain. Then comes the heavy lifting, exposure and response prevention. Patients are carefully guided by a pro to face their triggers, like touching that doorknob, but are coached to not do their compulsions. Over time, the brain literally learns that the anxiety will naturally drop on its own without the ritual. Finally, they learn relapse prevention tools to lock in those massive gains. Finally, Section 6, living with hope, reclaiming lives. Let's wrap up this explainer by looking at what the future holds for those who courageously step forward, because there is so much hope here. If you take nothing else away from this explainer today, remember this number, 70%. Ultimately, 7 out of 10 people will see significant symptom improvement with proper targeted treatment. OCD is highly treatable. You just have to get to the right professionals who know exactly how to administer these specific therapies. Yes, it's a chronic condition. It might wax and wane over a lifetime, but with the right therapeutic toolbox, medication, and lifestyle adjustments, it is incredibly manageable. Patients go on to have brilliant careers, amazing marriages, and totally fulfilling lives. This disorder does not have to dictate your life's potential. So I'm going to leave you with this thought. We started with the devastating reality of a 17-year delay in treatment. Knowing what you know now about the complex, terrifying, and completely misunderstood nature of OCD, how can your awareness today help smash that stigma? How do we change the way we speak about mental health so that the next person suffering in silence feels safe enough to step out of the shadows and get the help they absolutely deserve? Thank you so much for joining me for this explainer. Keep learning, keep questioning, and I'll catch you next time.